Hello dear friends and colleagues, I'm Stanislav Chernog, the author and creator of the online school of vector massage and somatics, and today we will talk about infertility. For starters, a little story for you. When I started my career as a massage therapist, I worked in a small town, the city of Obninsk, with a population of 100,000 people. I worked with men and women. I had many women who came for body shaping, and so I worked with the region of sacrum, and after a while, in those days, I started dating my future wife. So, after a while, I was walking around the city and met my patient, and she said to me, "Oh, Stanislav, thank you very much for your work. Everything is just fine, and after I worked with you, I got pregnant right after our work." So, several of my patients came to me, met me on the street, and my wife looked at me with great suspicion. However, I had absolutely nothing to do with it, in the sense that it was my work as a massage therapist that led to the fact that the fertility of women increased significantly, and even those women who had problems conceiving overcame these problems. Their body was able to conceive and carry a child. As a curious person, I began to dig, to research the topic, and wondered how the work on improving the aesthetic shape of my clients' bodies leads to an increase in their fertility. It is in this video that we will tell you how it works, what is the reason and what needs to be done in order to increase human fertility. A pleasant detail of this method is that it not only increases fertility but also increases the libido of the person with whom we work with this method. First of all, we need to realize that not all infertility problems can be solved in the way that I suggest to you. For example, in some cases, infertility is due to the fact that a person has bacterial and viral diseases, and these bacterial and viral diseases lead to the fact that the organs are not able to conceive. In addition, in some cases, problems with conception are associated with disruption of the endocrine system with a hormonal background. In addition, in some cases, the cause of infertility may be psychosomatic in nature. Having a child is extremely difficult. I am telling you this as a father of 3 children, and accordingly many women intuitively and consciously do not want to have kids. This is a common situation, but in a huge number of cases, problems with infertility are due to the fact that the organs that are responsible for childbearing are in conditions that don't allow this organ to work normally. In order to understand right now what condition your organs are in with the genitourinary system, I offer you a simple test. We have a pubic bone, here it is located in front of us. There is a simple reflex connection. If we press on the pubic bone in the middle, we will find in some cases complete painlessness, and in some cases it will be quite sensitive. Soreness in the middle of the pubic bone indicates a violation of the functioning of the uterus and indicates a violation of the functioning of the prostate gland in men. If we press on the lateral surfaces of the pubic bone, then pain on the lateral surfaces indicates problems with the ovaries or testicles in men. If we press at a distance to produce 2 fingers from the middle of the pubic bone and find pain there, then this disease will tell us about a violation of the functioning of the fallopian tubes of women or the excretory ducts in men. Accordingly, detect the disease in the pubic bone. If it is, then this means that you have problems with the genitourinary system. What could be causing these problems? These problems may be associated with a violation of the blood supply, with a violation of the innervation, and with a violation of the outflow of lymph from these organs. The first problem may be due to the fact that the intestines in humans are lowered. This in turn leads to the fact that the organs are squeezed and blood does not flow into them in a normal way, and they do not function normally. In addition, in a huge number of cases, problems with the genitourinary system are associated with the fact that the posture is disturbed and the nerves that innervate our pelvic organs do not work normally, and this in turn leads to disruption of the functioning of the organs. A big problem is also the stagnation of lymph in the pelvic area, and here we have a model on which we can quite effectively and efficiently show how it looks at the level of appearance. If we talk about working with the anterior surface, then a good help in the treatment of infertility, especially in cases where there is pain, is the study of the pubic bone. Here I draw your attention to the fact that this work must be careful. You find a painful point and press on it with such force that it is not excessive and painful for your patient. You can also work with your pubic bone, and if you find soreness there, then work on these zones for 3 minutes every other day until the soreness disappears. In addition, exercises related to exhalation such as diaphragmatic breathing and, for example, vacuum exercises when you lift the intestines and thus free the genitals from stagnant blood will be extremely useful for working from the front surface of the body. And we continue, and let's roll over on the tummy. So in order to work through the problem of infertility from behind, you need to understand that firstly there is the problem of instability of the lumbar spine, when there is an excess amount of motion in the lower back. In addition, there is a problem associated with swelling of the sacral region. In addition, there is the problem of swelling of the attachment sites of the gluteus maximus muscle. Why is all this so important? When we talk about the lumbar spine, we must understand that its instability leads to the fact that the nerves that come out of prostration between the lumbar vertebrae are grounded. Pinched due to the fact that when there is excess mobility, the small muscles that connect the vertebrae to each other are strained excessively, and thus the nerves are clamped by these small tense muscles. Thus, in order to ensure the normal functioning of the nerves, we need to shift the load and make the correct tone of the lower back. When we talk about the sacrum, the dysfunction of the gluteus maximus muscle leads to the fact that it does not contract normally, and this leads to the fact that the fluid that should have been squeezed out by the fact that the buttocks either contract or relax, and the fluid starts to stagnate. In addition, inflammatory processes in the sacrum and in the places of attachment of the gluteus maximus lead to the fact that there is always an excessive attention of the immune system to this region, and constant inflammation leads to an increase in the amount of lymph in this region. On our model, we can quite clearly see that there is a problem in the lumbar spine. Firstly, there is such a rounded area of puffiness here. It can be directly felt right here. If we start to grab the skin in the sacrum area, we find that it is about 3 or 4 centimeters here. This space is very tight, very dense, and can be compared approximately like a gel-like bun, which is located in this region. Another very interesting point is that here on one buttock there are multiple stretch marks, divergence of the deep layers of the skin which lead to scarring, and accordingly this suggests that here in this region there is excessive swelling. That is, in some cases this muscle increases in volume and this leads to a divergence of deep tissues. In addition, we can highlight several enlarged vessels. Here we have a vessel. I'm not sure that this will be noticeable on camera, but nevertheless, if you find protruding capillaries and blood vessels in the area of the sacrum and lower back, you see blood vessels in general, then this is a bad sign, or a good sign that you need to pay attention and treat this area. Let me show you this work in isolation. Take some oil and our task will be to massage this region. When we massage it, we increase the intensity of blood circulation on the one hand. Secondly, we draw the attention of the nervous system to this region, and finally, we help the body remove excess lymph, stagnant fluid from this region. It must be understood that lymph stagnation is a problem that does not allow the female body to work normally and thus conceive a child. How does it work? The fact is that the lymphatic system is the system that removes debris from organs and tissues. Relatively speaking, the conception and bearing of a child is an extremely energy-consuming and difficult process for the female body. Exactly for this reason, every time the female body detects that there is a huge amount of decayed products around, the female body says, firstly, we are in poor condition, and secondly, we may conceive an unhealthy child. Don't care about conception, don't care about libido, we better bring ourselves into a good state. We will not meet with partners of the opposite sex, and if we do, we will not conceive a child. We attribute consciousness to an organism, but the sequence of events is something like this. All women who were in such poor health that it was risky for conceiving a child gave birth to weak children and accordingly left a small contribution to the population. The vast majority of people within modern civilization have problems with the lymphatic system. This is also due to the fact that we lead an incorrect and unnatural lifestyle, engage in activities, for example mental activities that are not typical for a person, eat food that is not typical for a person, and as a result, the lymphatic system, which was formed in completely different conditions, it cannot cope with the loads that exist in the body in the modern world. Therefore, working with the lymphatic system is highly moral work because it helps people solve problems that they themselves are not able to cope with. In addition, this work is highly profitable because the number of people with problems with the lymphatic system is truly huge. Please note that, as I told you, I massage the place of attachment of the gluteus maximus muscle. If you ask my model what is happening to her right now, she will almost certainly say that there is a feeling of deep, very pleasant warmth in the pelvic area. Yes. This warmth is spreading, and this feeling of warmth is the evidence that capillaries are opening, deep capillaries that are closed in the pelvis, sacrum and genitals. This leads to the fact that the intensity of blood circulation increases, which leads to the fact that the decayed products that are stuck in this area are carried away with the outflow of blood. Also, right now, my subject's nervous system is highly focused on the sensations that come from receptors inside the skin, inside the muscles, and inside the tendons. The nervous system is the all-seeing eye. If the nervous system detects some trouble, then the nervous system redistributes resources to the area where problems are found. At the first moment, pain may occur. This soreness is perceived by the body as evidence of trouble. As we work with this region, there is a decrease in the level of soreness, and this is a clear sign that we are working in the right direction. Please know that I work with one basic movement. It's a circular movement. It is very important here that you work in the right areas. We work in the area of the sacrum. We work in the area where the muscles attach to the sacrum and pelvis. In addition, we work in the region of the cross-lumbar transition. In order for this work to be effective, we need to spend quite a lot of time on it. That is, in the case of our model, I would recommend that she takes about 7, 8, 10 massage sessions in order firstly to remove congestion and secondly to restore innervation so that the nervous system correctly assesses the current state of the structures. In addition, to restore the functionality of the muscles, which forms a change in posture and thus leads to disruption of the functioning of the pelvic organs. Each time we work according to the method that I propose. We spend about 20 to 40 minutes on this work in one session. This is a job that requires a fairly large physical investment. A good sign that you are working in the right direction is a consistent decrease in soreness and a pleasant, lasting sensation after you have finished your work. It is very important that after you have worked with a person, you have achieved a change in the sensation inside the pelvis, so that your patient does not freeze after that. It is important that the person wrap oneself up and keep this feeling of warmth for half an hour or several hours after the session. The fact is that very often problems with reproductive function arise due to the fact that at some point the pelvic region freezes, which leads to a spasm of small vessels inside the reproductive organs, which in turn leads to the fact that the blood supply is disturbed and the organs function worse. After we work for a while and warm up this area, it is very important that the body stays in a state of warmth and relaxation for a while so that blood circulation is restored for the longest possible time. A very important point I want to mention is that many gynecologists, if you ask them if it is possible to massage for problems with female organs, they will tell you a categorical no. Their position boils down the fact that when we are doing a massage, it leads to an increase in blood circulation, and this in turn can cause an increase in the likelihood that benign tumors that arise there, for example fibroids or cysts, will grow more intensively. To some extent this is true, therefore some rules must be followed in order to do this job. Well, for example, you need to learn how to work with the lymphatic vessels and nodes that are in the groin area. If we have not previously worked out the lymphatic vessels and nodes, then an increase in the intensity of blood circulation will lead to the fact that blood will come to the organs but will not be able to exit them normally. Therefore, work with lymph is very important. In addition, it is very important that you restore the functionality of the muscles that keep the pelvis stable. Again, in order to do this, you need to work according to the protocols. In this sense, I want to convey to you the main idea. It may seem that everything I show is simple and you already know how to work with the pelvic region and how to improve the fertility of women. There are pitfalls, there are protocols that must be followed in order to benefit your charges and not harm them. Well, in conclusion, I want to say that a separate area of work with fertility is gynecological massage or urological massage, when the work is carried out inside the cavity of the human body. You can treat uterine prolapse, you can treat prolapse of the internal organs, you can correct the state of these organs, their position in the body, but for obvious reasons we do not tell or show you these types of massage on an open channel. If this topic is interesting and important for you, then write in the comments and maybe we will shoot a professional course for people who would like to work with this. Well, a little cherry on the cake, turn over again. I will show you how we can work with the uterus through the ligaments that balance it without plunging into a gynecological massage. The fact is that the inguinal canal in women and men is a place that helps us to properly maintain the position of the genitals. The inguinal canal is formed sequentially by three muscles. These are the internal and external oblique muscles of the abdomen and the transverse abdominal muscle. In men, they form a channel that supports the testicle in the correct position and ensure its normal blood circulation. Accordingly, if the inguinal canal does not work correctly, then men will have problems with fertility, and in women, on the inguinal canal, this is some simplification, but nevertheless, the uterus is hung on it. We can work with the inguinal canal if we place our hand on the inner surface of the ileum in the inguinal fold, and working this place through outward and inward displacement will help to balance the position of the uterus inside the abdominal cavity. We work with the place of attachment of the muscles along the inner edge of the ileum, right here. That's the way it comes in. We put our hand on the inguinal fold, move this direction up to the side and move it in and down on one side and on the other side. A very curious fact is that it is precisely in my patient on the left side that it is necessary to shift the structure upwards. When I shift it down, somehow not very much, not that. The model feels this, but on the right side, the downward shift is right for good and the straight upward shift is not very good. Yes, not that. That is, relatively speaking, the uterus is displaced by several stones and somewhat deployed. Accordingly, such problems can lead to the fact that it will be more difficult for the embryo to attach to the uterine lining. It will be more difficult for a fertilized egg to pass through the fallopian tubes, and the chance of conception will be much lower than if the uterus was positioned correctly. Write about your experience of how you struggled with infertility problems, how you solved this problem. Support us with likes if you want us to make more videos on the topic of infertility, male and female health. And with you, as always, was Stanislav Chernog, the author and creator of the online school of vector massage and somatics and the YouTube channel of the same name, where we learn how the human body works, we understand how, using simple and easy techniques, we can improve health in a wide variety of ways. And most importantly, we learn how to earn good money doing this truly useful and important business. Until we meet again, friends, goodbye.